okay? This is one of your hardest ones, all right? Autism is a spectrum disorder, okay? Meaning they can have what's considered Aspergers, which is a very, very high functioning form of autism, to severe autism, where they don't even have the ability to fully communicate with you, okay? So how do you include these guys? Every single part of that range can be included in your normal class. Every one of them, okay? So know that it is possible. Characteristics that you're going to be looking at, they're going to have difficulty with communication, okay? That is going to be hard for them. Social interaction is very difficult. That is the key part of autism and Asperger's, is they are the social person that wants to stand back in the corner, don't talk to me, don't come towards me, just leave me alone. Having to talk and speak is just the absolute worst thing you can do. As an instructor, what does that mean? Don't put them on the spot. Don't ask them the question and put them on the spot in the front of your classroom. Okay? That might be a reward for somebody else to get to come up next to you and answer a question and run a drill. That is the royal nightmare for this child. Okay? Don't hold them up to do that. Okay? All you're doing is scaring them away. They are going to be very restricted in their player interest. And what I mean by that is they're going to get stuck on one thing. Okay? They're going to have one thing, that's their thing, that's their love. Your goal is to create variety, to be that one thing. Okay? Because they're going to perseverate on something. Okay? They will know everything under the sun, and every detail there is to know about whatever that one topic is that is that important topic to them. Your goal is to make that important topic to them variety. Okay? Challenges that these students are going to face are verbal and nonverbal communication. Okay? They're not good at that. They're going to have challenges, like I said, with social interactions. They're going to have poor eye contact. Okay? You're not going to be looking in the eye. You're not going to be looking up and focusing on the instructor. They're going to have difficulties with the balance and coordination. They have poor sense of direction. Turn to your left. They're going to end up going at a 45-degree angle to the right. Okay? You've got to be very specific with your hand gestures and things of telling them where to go, because they're not going to get it off of words. Alright? They have a poor understanding of social skills. These are the kids that are going to jump in to a group of kids that are doing something and say something that is completely off the base, and the other kids are looking around going, what the heck is this? Okay? You got to be there to try to help them out and notify your leadership team. Make sure they all know and are aware, so that when that happens, it doesn't catch them off guard. Okay? Your leadership team is there to help you with this. They're going to have motor delays. What are you seeing versus what are they saying? This is huge when you're dealing with autism and Asperger's. Right? Perceived defiance. They directly raise their inability to move forward from a topic. Okay? You see defiance. You see a child that's saying, "No, I'm not doing my kicks. I'm doing my punches." Okay? And what the child's really trying to tell you is, "I'm frustrated because I don't know how to do my kicks." Okay? I'm not good at my kicks. I don't want to do that because I don't know how to do it. They're telling you they're frustrated. They're not saying I can't. They're frustrated. Understand what they're really telling you. Distraction and focus. When the child's first day of class, they've got to be given something to do while the teacher's talking. Again, the belt is a great thing to do. Okay? That belt trick of holding onto your belt works for a lot of different things in a lot of different places. Alright? Consistency, no room for variation. Always acknowledge if you're changing. Okay? Guys, I know usually we do our kicks right after we're done with our punches, but today we're going to skip that and we're going to move right on to kata. That means that you don't have that child in the background going, "But we're supposed to do kicks right now. We're supposed to do kicks right now. Why aren't we doing our kicks right now?" Okay? That's going to help prevent that by acknowledging to them, "I know this is what we're supposed to do, but instead, we're going to do this." Alright? Anger, emotional response with correction, rejection. You tell them, "No, don't do it that way, do it this way," they aren't going to respond to that very well. "No," or "That's wrong," not words you want to have in your vocabulary when you're dealing with autism or Asperger's. Okay? Let's try it this way. Can you copy me? Can you copy Johnny? Look at Sarah right there. Can you look like her? And then when they get it the way you want it, Small changes that you can make to include children with adults and Asperger's and autism is find what motivates that student. Okay? Are they stuck on cars? Are they stuck on boats? Are they stuck on trucks? What is it that motivates that child? And have a reward for them. Okay? You got a chart for them, how many good classes they've had. You got pictures, you got little stickers of cars, and they get to put their car on their chart when they've had a good class. Whatever it is that motivates them. It's a star, whatever. Right? Expect the back talk and the defiance, and understand that that's not the same back talk that you're getting from your other students. It's coming from a different place. It's coming from frustration, not from I'm trying to be disrespectful. The student's going to perseverate on something. Know how to get them to move on. Okay? Find the trick to get that child to move on. It's going to be different for every kiddo, but every one of them will have something that you can get them off of that and back onto something else. Always have that second instructor available. If they completely lose it, if they're having, they're just going off the deep end on it, have that student or instructor available that can pull them off the floor, calm them down, what's going on, what are you frustrated about, okay, now let's move on and go to the next thing, okay? Let's get back out into class and let's go out and do our kicks, all right? Use creative techniques. If you do creative or XMA or any of that kind of thing in your school, even if it's just traditional forms done in music, do something that is less rigid and a little bit more able to just flow. Okay? Because remember, they want to be in constant motion. I don't want to punch and stop. I want to punch and move right on. Alright? Use rhythm with the more severe students. You're going to need to use a lot of rhythmic techniques to do things. Okay? Create a pattern. Hands up on my legs, hands down on my legs, hands to high cup, and I punch. Whatever it is. But create a rhythmic pattern to what you're doing, and you're going to get them to be more successful. Okay? They're not going to get it just by doing what you normally do in class. Last one I'm going to cover for you today is Down syndrome. It's a genetic condition that causes physical and intellectual delays. Okay? You're going to look for delays physically and intellectually. They're going to have speech difficulties. They're going to have an increased incidence of psychiatric disorders. Okay? These are one of your primary guys. They're going to have something else other than just this going on. Alright? You're going to have a lot of low tone. Okay? But yeah, they're some of the strongest people you're ever going to meet. Okay? Low tone means those ligaments are very loose. Do you do wrist locks in your school? Do you do arm bars in your school? Right? These guys aren't going to feel it. They're going to let you go, 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 go. Those ligaments are so loose, they're not going to feel it. Okay? So make sure you're careful for that. Increased joint mobility goes right along with that low tone. They're going to have underdeveloped balance, coordination, cardiovascular endurance, and respiratory system. So if you're doing a fitness class, understand, they may not be able to do every repetition. Okay? That cardiovascular system is not going to be fully developed regardless of age to keep up with everything. Challenges that they have, they're at risk for joint injury. Anytime you're doing any kind of joint locks, you got to be very careful with these students. You got to make sure that their partner knows to be very careful, all right? Because they're at risk for injury with that. They're going to have a slower learning process. It's going to take them time. You know what? They're used to this. Their parents are used to this. This isn't new. Their parents aren't going to expect them to keep up with whoever they started with. They're not going to expect to keep up with whoever they started with. They're used to moving at a slower pace than everybody else, whether it be in school or anything else that they've done. They need a routine. Okay? Again, we're back to that having a routine that you do and acknowledging if you're going to change that routine. These guys are the most lovable, huggable, in your face, on top of you individuals. Okay? Downs kids are. They want to give you a hug. They want to be right there in your personal space. Right? They're going to attach to a specific individual. Make sure that individual is comfortable. Okay? With that. Make sure they understand what is going on and why it's going on. Make sure that they're comfortable with that. Alright? That's not something that's scaring them off. Alright? And then the AAI deformity. This is something that is kind of up in the air currently. Alright? It's the Atlas axial these students, all right? What are you going to see? What are you going to encounter? Like I said, they're very affectionate to the point that it's going to make somebody else uncomfortable. You're going to see decreased balance. You're going to have poor coordination, decreased endurance. You're going to have complications from other comorbidities, okay? These are the things that you're going to see with these Down syndrome kids that you're going to run into issues with. Small changes that you can make in class to include children and adults with Down syndrome. Set your class rules and expectations from day one. Again, that goes back to that very first intro. Let them know what the standard is, okay? Especially if it's someone close to you. They've got to know when they're on the floor, this is the rule, okay? When we're at home, that's something different, okay? Just like if you've got kids that take from you, okay? Place the student in your class that tends to move at a slower pace. So even if it's a 10-year-old, okay, that typically you would put in your youth class, you may want to move them up to adult class that tends to move at a little bit slower pace than the youth class, just because they're going to be able to keep up better, okay? After receiving permission from the parents, create an awareness to the other class members and instructors of other medical conditions that are present, okay? My brother's got epilepsy. He had a seizure in class one night. Everybody's freaking out. You know, and then I got my couple of people that know what's going on that are turning around going, it's okay, calm down. Got one student that goes over and sits and looks with him, takes care of the situation there. The main instructor just keeps everybody else moving on. Okay? Know what you're going to deal with, know what's going on. Okay? Don't emphasize rank progression. Okay? Again, they're not big on having to have that immediate reward. They're used to being behind everybody, but make sure that you praise what's new. What did we get? Okay? What's going on? What's new that I have today that I didn't get before? Okay? What can I do now that I couldn't do before I came to class today? All right? If you guys have Q&A, I know we're pretty much out of time, I think. But if you guys have any questions for me, one, I will go to booth 319, the affiliated acceptance booth, and I'll be sitting over there answering any questions that you guys may have, as well as if you can find me on Facebook. If you go to American Sport Variety Centers, you gotta make sure you include the S, and like the page, you can instant message me on there, and I'm more than happy to answer any questions for you. There are 1,000 different diagnoses that you're going to encounter and you can deal with. Advertise for that which you feel qualified and capable of handling. Okay? Advertise for it. If you don't advertise, you're not coming in your door. Alright? You gotta tell people that yes, I can do this, yes, this is how I help with this particular individual. Okay? This is another section of clientele. You got on your website, you know, Little Dragons 5-6, youth is your 7 to 10, adult or teen, 12 to 17, adult 18 and up, special needs. It's just one more right there, okay? And it's got its own tab and its own blurb of here's what we specialize in, here's what we can teach, here's what we can train, here's what we know how to do and how we can help you, okay? Give us a call and we'll help you out with your child and get you some relaxation time as well, because those parents need that break even if it's only for 30 minutes, okay? Make sure this year's a little different on doing your reviews, guys. So those of you that attended today, please, if you have not already, download the MA Super Show apps and put in your reviews today. That's how we get graded on how we did. And make sure that you, if you don't do that, at least turn in those little postcards that they give you that tell them how I did and what you guys thought of the presentation. Was it something that was beneficial to you that you think you can take home and utilize and got something positive out of it? So make sure you guys fill that out, and I will meet you guys over at booth 319 at affiliated acceptance to answer questions for you. If you gotta get out of here and get going and move on, I understand. A lot of people have flights to catch today. Catch me on Facebook at American Sport Variety Centers, and I will get anything answered for you there as well. If you want a card, got that written down.